Good afternoon. Today I will be presenting my study on ellipsoids on loss and overlying retinal changes in type 2 macular telangiectasia based on optical coherence tomography and OCT angiography. No financial interest. Macula type 2 is a neurodegenerative vascular disorder which is bilateral and can be non-proliferative or proliferative, and presence of perifoveal retinal whitening, crystalline deposit, etc. are described in the clinical findings of Macula. And OCT is an invaluable tool in diagnosis with characteristic OCT findings. Recently, Opta has helped us to study the abnormality in perifoveal capillaries in these eyes with deep and superficial capillary plexus involvement, rarefaction or loss of capillaries, abnormality of capillaries, and invasion of the outer non-vascular retina. The Macula study has reported EZ loss as a surrogate measure for visual function in Macula type 2, which might be considered more suitable than microperimetry since it is very objective, and EZ loss has been identified as a prognostic biomarker. Recently, NFAS imaging have been described to evaluate the extent of ellipsoids on loss in Macula. However, the correlation of EZ loss with other OCT and Opta findings in non-proliferative Macula has not been well described. So, aim of our study was to report changes in retinal layers overlying areas of EZ loss in type 2 Macula based on SD-OCT and Opta. So, it was a retrospective observational study of 1 year duration, and 40 eyes of 22 patients diagnosed with type 2 Macula having documented EZ loss was involved, and patients with other concomitant macular pathologies and media opacities were excluded from the study. So, OCT and Opta scans were acquired using spectralis machine. The preset 20 micron slab of choriocapillaries is moved to the ellipsoid to generate an NFAS image of the ellipsoid. Then the limit of EZ dark area was delineated. In cases for which a vascular signal appeared on the outer retina, image was transformed into white and black, and it's contour reinforced and superimposed on EZ NFAS imaging. And coming to the OCT features, island drape sign, hyperreflective middle retinal layers, presence of crystals, hyporeflective inner and outer retinal cavities, outward bending or collapse of inner retinal layers, retinal pigment clumps, etc. were noted. And Opta was graded into grade 1 to 4 based on the presence of vascular anomalies in the temporal, nasal and circumferential, and presence of neovascularization. Coming to the result, 40 eyes of 22 patients were included and mean age was 64.7. The mean visual acuity was logMAR 0.3, and among the OCT features, hyperreflective inner and outer retinal cavities were the most common findings. And on assessing the visual acuity, outward bending of inner layers, that is collapse, and hyperreflective retinal pigment clumps, presence of macular hole and others were associated with poor visual acuity. So, hyperreflective cavities in inner and outer retina was the most common findings, which are usually degenerative, and visual loss was moderate in these eyes due to associated EZ loss. And hyperreflective middle retinal layer has been identified as one of the earliest findings in type 2 Macula, but in our study, less than half of the eyes had this finding, maybe due to more advanced presentation in our study population. Coming to the structural correlation, bending of inner retinal layers occurs due to the collapse of the layers, and hyperreflective intraretinal lesions are usually associated with pigment plaques. Both these findings were associated with poorer visual acuity. On Opta examination, grade 3 and 4 were mostly seen, and Opta grading, as obviously the grade 3 and 4 were having poorer visual acuity. 80% of the eyes had significant abnormality of both superficial and deep capillaries, and ellipsoid zone loss eyes had severe grades. Outer retinal vascular invasion was seen in 47% of patients, and this correlated to EZ loss areas in 84% of the eyes. So, occurrence of omnious proliferative macula with subretinal new vessels is a relatively rare event. It can be preceded on Opta by a phase of invasion of the avascular zone. The DCP vessels involve outer retina specifically at the area of EZ loss. So, EZ loss and corresponding outer retinal Opta could be used as a screening tool. In a study by Godric et al., 83% eyes had capillary proliferation circumscribed to area of EZ loss, which is comparable to our study. Limitation was it was a retrospective study with small sample size. So, to conclude, Opta and SD-OCT will be useful in evaluating disease severity and also comprehending the disease severity, suspecting proliferative disease, prognosticating and planning follow-up. These are my references.
Thank you, Dr. Shivani. would you like to call this as a macular hole as you're finding, or the loss of tissue? Because in macular hole you don't find loss of retinal tissue. This is because of the retinal tissue loss.
No, this is because of the retinal tissue. It is a vascular and degenerative disease. Muller cell loss is there and vascular changes are also there.
It does appear like a macular hole, but actually it is not a macular hole.
Then can you just show me the picture once again?
Looks like a
But
You'll have to go back, doctor.
the first
Stop
picture.
just before this. This is the one that
Yeah.
you're talking about. Yeah. So you have a collapse of the inner retinal layers. So again, this is classical in macular type 2. So
This is not called as macular hole.
did you say macular hole?
no,
Okay.
other findings, among the other findings, there are pseudomacular hole and all.
Okay.
This one is not
Right.
macular.
Right.
What could have been the findings if it was a foveal burn? To me, the third picture it looks like maybe it's a foveal burn. Is it?
No, there is outer retinal cavitations are there in the third picture with the collapse of layers.
Right, doctor. Thank you very